My name is Kim Erickson. This is my wife and care partner, Libbe. We're from Stillwater, Minnesota. I was diagnosed with Parkinson's in 2010 and have been involved in the research advocate program since 2012.
I'm also a nurse by profession, and my father has Parkinson's as well as Kim. So it's been really a marvelous opportunity to be a research advocate and learn more about the process to assist my own family. Well, our association with Struthers came about obviously because Kim was a patient there, and they actually nominated him to be a research advocate in this program, and so we both attended that, and so that began our association with the Struthers Institute. After that, then, they began working on a project to determine what it was that kept people in research, and came to us for a little assistance with that, having already met us in other research endeavors. So we sat down with them, and they designed initially a questionnaire that they would have people fill out, people who had been in research process there over the last 3 years, and then had us help them design the questions. And then they also came up with a follow-up, more in-depth questionnaire, which they had us help with designing the questions and the format for that as well. So within that process, PDF approached us looking for suggestions for people who might be good candidates for this leadership award, and in that process we suggested Struthers, and Struthers applied for the grant.
We're involved with a study with Struthers Parkinson Center in a study to determine why people stay in research studies. Again, the overall goal was to find out what factors would cause them to drop out, to stay in, or to not even enroll in the process. So they looked at demographics, the distances people came from, all sorts of information. And we were asked to sit down with them, review the questions that they had come up with, and see if there were any modifications that we would suggest to improve the questions and to maybe add others and delete some, just to make a better survey. What I recall is that with the number of questionnaires sent out, they had a very high percentage of returns on the surveys. They were around the 90th percentile return rate, which is, I think, normally the response they would expect to be in the 60% range. So they had devised very good questions, and were able to get a large amount of information on why people stayed in research studies.
Yeah, I think you're correct on that. Is that it was probably in the high 80s, low 90% of response, and there were surprising results. We've talked a lot about the problems about getting into research and such, but when they're approaching it from the angle of what kept people in research, it was, interestingly enough, the feeling like that they were contributing. That was sort of the overwhelming positive response. Not being paid or being, having closer access to medical care. It was more that they wanted to contribute.
We've been involved in several studies, and each one has been rewarding. It's interesting to find out what's being researched, and again, as I mentioned earlier, that the dedication of the researchers is very astounding. A lot of them have committed their whole lives to developing a cure or finding treatments that do actually work, and they are really working hard out there to help the Parkinson's patient.
Yeah, there is really that sense of having contributed something, and for everyone, feeling like you're purposeful and useful, and that you've contributed something is you can't deny it. It makes you feel good, and it's not to mention almost all of the studies we've been in have been fun to a certain extent. Getting to just chat with the researchers and find out, the background is their individual backgrounds, why they're doing the study they're doing, what they hope to get out of it, the relationships that you make with the research staff and the physicians and that, and it just makes you more involved in your patient care too, and your accessibility to people giving the patient care is improved as well.